have knee pain, stay tuned because I'm going to talk today about one of my favorite ways to solve knee pain and regenerate the knee. Hi, I'm Dr. Angela Yeagley. Welcome to Sage Health TV. Super excited today to talk about one of my favorite therapies for the knee and for other joints, but today we're going to focus on the knee. That is PRP, which is platelet-rich plasma that we use for knee regeneration. So interestingly enough, a lot of the population has knee pain. So almost about 25% of the population at some point has knee pain due to injury or due to arthritis. And what's really fascinating is that actually over the last 40 years, the incidence of knee pain is rising. And so I would say they don't really know why, but my guess is due to poor diet, a lot of processed foods that are inflammatory. So those things are manifesting themselves more, you're feeling it more. This particular therapy is one that we use often when people are dealing with, can be acute knee injuries, but also for chronic knee pain. And you have been working with your regular doctor or your orthopedic doctor, and the things that they're offering you are maybe offering you temporary relief. They're giving you a cortisone shot, or they're doing something like hyaluronic acid. And that's more just creating like a kind of a liquid has a really good, like a high viscosity, meaning like it's thick. So it helps to buffer in there, but it's not actually repairing anything. And many times when that fails, the next option is knee replacement. And just want to tell you that there are so many other options besides actually doing cortisone, or the hyaluronic acid is fine. We can do this in combination with that, or definitely knee replacement. Okay, so what kinds of things would we be looking at treating? So definitely in the studies, absolutely mild to moderate arthritis has a great response to PRP. So things that we're thinking about, mild to moderate arthritis, severe arthritis actually can respond to it as well, but many times if it's already bone on bone, we really have to think about incorporating some other options as well. And then types of injuries like meniscal tears, ligament tears like your ACL, PCL, if you have tendonitis or if you have a bursitis. So again, it doesn't have to be, it can just be inflammation like in the tendonitis and the bursitis. This will work because many times those they are hard to heal areas. So the interesting thing about the knee is that it has very little blood flow, and once an injury happens or the arthritis is there, your body's ability to repair it is reduced compared to other types of tissue, just because again the flow is so much less and there's so much less oxygenation in the joint. So by introducing something that actually pushes and drives what we call growth factors, and I'll get into that. It allows that tissue, it gives it more resources to be able to regenerate itself, which is hard for the body. So I want to talk a little bit about one of my people, and she's a 68-year-old woman who's very active and came to me with knee pain, had done all of the other things, all the other standard things, and they were basically saying what we've got left is PT, and then maybe you just deal with pain until we actually maybe do some surgery. So we did a PRP injection in her knee, and she was good for a year, zero pain. Came back because it was starting to bother her a little bit again, so we did it again, and then it saw her just recently, and that had been 2 years, and still that knee is pain-free, which is, I think, is really cool. So now that might not be how every person responds to this, but she actually is not an atypical example of how well PRP can work to heal the knee. Next, there was a study where they compared a bunch of people's knees injections with PRP and versus getting like a stem cell injection. And what they found, which was really cool, these were stem cells actually from the bone marrow, and so a higher potency stem cell, and so one of the stronger ones, and that they found they followed all of these people from starting at 3 months, checking in on how well their knee felt recovered, their level of pain, function, and it was exactly the same at the 3-month check-in. Then they went 6, 9, 12, they just kept every 3 months up to 24 months. The amount of pain relief and improvement in function was the same from PRP compared to stem cell. And the reason why I think that's so important is because many times for people, regenerative medicine, the barrier to it can be cost. And PRP treatments are in the hundreds of dollars compared to stem cell, thousands upon thousands of dollars. Like those bone marrow stem cells, usually somewhere between 10 to 20,000. And I'm certainly not saying that stem cells are not effective, not at all. but we have an alternative that is incredible that I think should be explored maybe before you go down that route. Okay, now let's really talk about what is PRP, platelet-rich plasma. So what that is actually, it is the extracted platelets from your blood. So the way that we get your PRP is we take about 6 vials of blood and then we put it in a special machine that spins it down and extracts your platelet. And so then we take that out along with your plasma. So it looks golden, and then we activate your platelets. So we do that with calcium. That's the traditional way. Here we also add ozone, which has been found to activate the platelets. So we do both. And then, so once the platelets are activated, what do they do? So it's a high concentration of platelets, and they start to release growth factors. So what those are basically, they start pushing the healing process like many stem cells, which I think is just so awesome. I'm very curious, who was the first person who really thought about, let's activate platelets and inject them in places and see what they do? It's crazy. But so once they're activated and those growth factors are starting to release, they start pushing actually the healing and repair of the cartilage in the area, the ligaments in the area, the bony areas related to the arthritis. Just in general, since the PRP is going into that space, like if we're thinking inside the knee joint, right? It's going in and starting go to all of those areas. And you can get it more specifically if somebody has what we would call like medial inside knee pain. You're like, it hurts on this side. You can more target, inject more towards that, and it can make a difference, as well as we'll put it everywhere actually. Once you do the injection, what should you expect, right? At the time that it's done, sometimes, especially if we are looking at if it's really working, it can make your knee a little more tender at the time, because what we actually have is an inflammatory process. This sounds like counterintuitive. You're like, wait a second, I thought it's supposed to be reducing inflammation. And that is true over time, but in the moment, actually, it is stimulating inflammation. So when you think about when you get cut, right? Inflammatory cells go to that site and they start replicating. They bring in the white cells, they do all of that so it can start healing. And that is what happens actually when you're injecting PRP into the knee. And so the body starts rushing to the area and starts to repair all of that tissue. And if you remember what I talked about, like lower oxygenation of the area, it's like the body is spending more time and energy working on that space. It's pretty cool. So then you might be a little tender for like a day or two, and then usually you're good. The standard protocol is typically to repeat it within a few months, and that is how a lot of the studies are done with PRP. Sometimes we do a third, and that depends on severity. And of course, we wouldn't do a third unless you are already steadily making improvements each of the injections, but sometimes 3 can be advised. And occasionally, like my one person here, we did 1 and I thought, okay, come back in 3 months. And she's, I'm doing great. I don't even need it. And so perfect. That happens. Fantastic. So yeah, plan on that. Then are there any side effects? And essentially, no. It's your blood basically, and you're not going to react to that. And again, besides a little tenderness after it's injected, that's it. And some people don't even really feel that, so that it's not a guarantee that you'll be tender. What are other things that we look at doing? Because we are holistic physicians, of course, we really like to support you in a lot of different ways to just push the healing of your body. So of course, we also recommend like joint supportive nutrients. So that's going to be like collagen and glucosamine and hyaluronic acid oral, as well as chondroitin. And then we do anti-inflammatory herbs. So we'll be doing like turmeric and boswellia and bromelain. Vitamin C is really important for connective tissue healing, because your body, when you're injured, the need for vitamin C goes through the roof, many times like up to somewhere between 5 to 10,000 a day. So if you're injured, I would go ahead and start on that. And then another cool thing that we actually recommend before you have PRP is actually to do IV vitamins. And if we think about the nourishing your blood or the richness of your blood, like that improves when we're adding vitamins to your body. So I'd probably have you do 2 of them, maybe 3, just depending on, are you pretty nutrient deficient and am I seeing that in your blood, or do you have a history of that? Or do you have other types of chronic conditions that are really pulling out your vitamins? If you really want to maximize your own PRP, I would do the IV vitamins and start on those other like anti-inflammatory and nourishing like nutrients for your joints. And then last thing is diet, actually. A lot of good research on reduction of joint pain with an anti-inflammatory diet. So typically that's like gluten and dairy free, as well as like you're taking out sugar and you're taking out processed foods or like fast foods, right? If we're working on like a whole, like comprehensive, holistic plan, we do really want to incorporate all of those. I will say that I've had people not really focus on their diet, take minimal vitamins, and the PRP still will work. And I would argue to say that a lot of the studies that are done traditionally, these are standard medical centers, they're not having them really change that either. So it can still work. You don't have to do all the rest. I just encourage you to. So if you have any questions, if you are in pain, if you're had an acute injury, if you have had chronic pain due to arthritis or chronic injury, like many times we can get a little tweak in something and then it's never really addressed, please come in. Please let us know if you have any questions, and I would love to see you. So thank you for joining me, and I'll see you next time.